Hi everybody, Dr. Ahles here. In this short video, we're going to talk about what happens when we can't buffer the blood correctly. So we'll talk about the condition of acidosis, where our blood is too acidic, where the pH is too low, and alkalosis, where the pH is too high. We don't have enough hydrogen ions in solutions. Recall from our discussion about body fluids that the normal pH range in the body is 7.35 to 7.45. We've discussed how there are many different buffering systems that the body uses to stay within that range. That being said, if the pH drops below 7.35, in other words, it becomes more acidic, the body will enter a state called acidosis. And if that pH happens to rise above 7.45, the body is entering a condition called alkalosis. When we talk about acidosis or alkalosis, this is going to come down to problems with two of our buffering systems. The first one being that respiratory buffering system, the second one being the renal buffering system. We can have issues with either of these systems, but when we're having an issue with the respiratory buffering system, the way you're going to know is there's going to be a problem with the carbon dioxide levels in the blood. They'll either be too high or they'll be too low, which is what's leading to the development of acidosis or alkalosis. When we think about what we call the renal buffering system, or when we're having what's called metabolic pH imbalances, you're going to recognize this with problems in the bicarbonate levels. Either bicarbonate will be too high or too low, and because of that, we're going to see problems with the pH. Notice on my scale here, when our pH is balanced, we kind of have a pretty good ratio of that pressure that comes from the carbon dioxide, that's acidic, and bicarbonate, our basic ion. If we have too much carbon dioxide in the bloodstream, that makes us go acidic. And that kind of acidosis is called respiratory acidosis. So our pH is too low because we have too much carbon dioxide. Our pH might also be too high though, or too low, excuse me, because we don't have enough bicarbonate ions in our system. Because our bicarbonate ions are eaten up by the metabolic processes inside our body, we would call this metabolic acidosis. So too little bicarbonate or too much carbon dioxide, both of those make our body enter this state of acidosis, where we're too acidic. And the opposite is true as well. If we have too much bicarbonate in our bloodstream, or too little carbon dioxide, both of these lead us to this state of alkalosis, where we're too basic. Notice that when we have a problem with the bicarbonate ion, that's a metabolic alkalosis. When we have a problem with carbon dioxide, that's a respiratory alkalosis. When we have these imbalances, for example, with the renal system or with the respiratory system, the other system that is not currently malfunctioning is going to try to fix it, or it's going to try to deal with the issue. So we'll see in a moment what we talk about called compensations. Compensation is when I look at the bloodstream, not only can I see what's making me be acidic or basic, but I can also see the way that the other buffering system is trying to fix it. So here's what this is going to look like. Say our renal buffering system is not working correctly. We have metabolic acidosis or metabolic alkalosis. The respiratory system is going to kick into gear and try to fix these problems. So if we're in a state of metabolic acidosis, the process of ventilation will increase. If you remember from our discussion of the respiratory buffering system, this is the way that the respiratory buffering system dealt with acids in the body. If we release more carbon dioxide, that helps the blood pH to go up. So just like we were talking about with how the respiratory system, buffering system normally works, we see that here in metabolic acidosis. And in metabolic alkalosis, so again, we're having a problem with our bicarbonate levels, ventilation will decrease. That's going to help us to hold on to carbon dioxide to help to lower our pH to get it back to normal. So this is what my compensations would be if the renal buffering system is malfunctioning. If the respiratory buffering system is malfunctioning, now the kidneys are going to compensate. And we think back to our renal buffering system to see what kinds of effects we'd have. So if we're in a state of respiratory acidosis, meaning we are acidic because of our sequestering of carbon dioxide, the kidneys will increase the level of bicarbonate ions that they have that are circulating in the bloodstream. If we're in respiratory alkalosis, the kidneys will actually release bicarbonate ions to get them out of the bloodstream to bring us back down to our normal pH. So over here, we've got a picture that is a little confusing, but also when you understand it, helps a lot. I've got two states, acidosis, too acidic, alkalosis, too basic. If I'm in an acidosis state and my kidneys are trying to fix it, so this means I'm in respiratory acidosis, my kidneys are going to make more bicarbonate ions. And if you remember, when we make bicarbonate ions, that causes us to release some acids. And by having more bicarbonate ions around, we can neutralize this acid. So my kidneys are going to address respiratory acidosis this way, whereas my lungs are going to address metabolic acidosis this way, increasing ventilation, which gets rid of carbon dioxide, leading us to lower carbonic acid. That helps to elevate the pH. And on the flip side, we're talking here about up top, respiratory alkalosis. Respiratory alkalosis means I'm too basic, so my kidneys will start to release bicarbonate. That's going to help to bring the levels, the pH in the body back down to being more acidic. And if we're in metabolic alkalosis, the breathing rate will actually decrease. The goal being, let's keep the carbon dioxide in so that we can have more carbonic acid. So that brings us to this table that looks really scary, but I promise it's not as scary as it looks. When we talk about pH disorders in the body, there's two options. Acidosis, we're too acidic, or alkalosis, we're too basic. When we're trying to figure out which kind of acidosis or which kind of alkalosis we're looking at, we just have to look at those things that my buffering systems use to figure out who's malfunctioning. So if a patient has respiratory acidosis, you would see, number one, that their pH is too low. That's across the board in acidosis. I've got a low pH. But then I look at their blood work and I see, oh, they have a lot of carbon dioxide in their blood. Remember that lots of carbon dioxide leads us to make more carbonic acid, which causes the blood to become more acidic. So thing number one we're going to see, the pH is too low. Thing number two, whole lot of carbon dioxide in the blood. Thing number three that we might see is what we call the renal compensation. And remember, compensation means I'm trying to fix it. So I've got too much carbon dioxide in the bloodstream. The kidneys can't deal with carbon dioxide, but they can use bicarbonate or hydrogen ions to change the pH. So as the kidneys reabsorb and make more bicarbonate, and as they release more of those hydrogen ions that come from that process, this helps the pH to increase because we have more basic substances. So in respiratory acidosis, my tip-off is going to be that carbon dioxide level being high. In metabolic acidosis, my tip-off is going to be looking at the bicarbonate ions. When I'm in metabolic acidosis, my bicarbonate levels in the blood are exceedingly low. So they've dropped down either because I've lost all of my bicarbonate through something like diarrhea, or because there's an accumulation of a lot of acidic metabolites like lactic acid or those kinds of things in the body. The more acids I have in the body, the more my pH is going to drop. So I see a low pH, but instead of carbon dioxide, I've got issues with bicarbonate. That tells me it's metabolic acidosis. The other thing I'm going to see, though, in a patient with metabolic acidosis is the respiratory compensation. The respiratory system is going to try to fix this problem with bicarbonate, but the only way it can fix things is using ventilation. So I can increase the rate of ventilation. As I increase the rate of ventilation, I'm getting rid of more carbon dioxide. And the more carbon dioxide I get rid of, the more I have to chop up carbonic acid. And when we get rid of acids, we become more basic. So you're looking at a patient. Their pH is too low. You want to check out, is this a carbon dioxide problem or is this a bicarbonate problem? That's going to help you figure out what's going on. But say we have a patient whose pH is actually too high. They have alkalosis. Notice we're still going to look for the same markers to figure out whether it's respiratory or metabolic. So if my carbon dioxide levels are very low in a patient with a high pH, this is a problem with the respiratory system. This patient is getting rid of too much carbon dioxide. So they have to break down their carbonic acid, their pH is going up. So how's the body going to address that? Well, the kidneys are going to start to dump bicarbonate. Bicarbonate is my basic solution. If I get rid of it, I'm going to become more acidic. That's what I do in respiratory alkalosis. In metabolic alkalosis, remember, it's not an issue with carbon dioxide. This is a bicarbonate problem. So in metabolic alkalosis, my levels of bicarbonate are very high. Remember, bicarbonate is basic, so I have a lot of it when my pH is too high. I'm going to address this with a respiratory compensation. My respiratory compensation is going to be a decrease in my ventilation rate, because when I decrease ventilation, I'm keeping more of that carbon dioxide, which I'm going to use to make carbonic acid. Ultimately, that carbonic acid brings my pH down and gets me back down to normal. So let's put this in a table that has not nearly as many words. You've got a patient either with acidosis or alkalosis. We need to figure out what's going on. If a patient has metabolic acidosis, we're going to be seeing a primary change in the bicarbonate levels. Metabolic acidosis you would see because of a decrease in plasma bicarbonate. You'd also notice a decrease in plasma carbon dioxide levels, that pressure. This is because of my compensation in the respiratory system. But check this out. Low carbon dioxide makes my pH go up. That's how I'd know that a patient in metabolic acidosis, this wasn't the first thing that happened. If this happens by itself, my pH is going to go down. Or excuse me, my pH is going to go up. I'm losing my level of carbon dioxide. If I have less bicarbonate makes me basic. Getting rid of that, I'm going to become acidic. Same deal down here with respiratory acidosis. My primary change is an increase in carbon dioxide. This increase in carbon dioxide makes me make more acid. This is my primary change. My metabolic compensation over here, what the kidneys are going to do, is they're going to spit out more bicarbonate. When they spit out more bicarbonate, that's going to make me more basic. That's how I know that this is my compensation, because what happened would make me more basic. I'm trying to get back to normal. Same deal applies down here with alkalosis. When I'm looking at metabolic alkalosis, my primary change, what happened first, was an increase in bicarbonate ions. Bicarbonate ions increasing definitely makes my pH go up. It makes me more basic. And here's that compensation, how my respiratory system's trying to fix it. My respiratory rate is going to go up. I'm going to get rid of, I'm going to be exchanging carbon dioxide. In respiratory alkalosis, my breathing rate, my amount of carbon dioxide in the bloodstream has gone down. It's excessively low. When I have a low level of carbon dioxide in the bloodstream, I'm breaking down my carbonic acid. That's what gets me so basic. So my metabolic compensation, let's dump that bicarbonate. If I dump the bicarbonate, my pH goes back down. I become more acidic. So whether this table is easier for studying or whether the other table is easier for studying, make sure with each of these different pH balance disorders, you understand what acidosis or alkalosis means, and you can identify each type, metabolic or respiratory.